Good evening and welcome to Beyond the Clinic. Welcome to Beyond the Clinic. This is the third in a series of webinars on topics related to healthcare, and we are delighted to be presenting this one during Oral Health Month. Before I do introductions, just a little bit of housekeeping. First, please put any questions you have in the Q&A box, and any commentary can go in the chat box. Another thing to keep in mind for best viewing, please view this in full screen mode. My name is Kit Doolin, and I am the Core Volunteer Coordinator here at Remote Area Medical. And I am delighted and honored to have with us this evening Dr. Brian Swann. Dr. Brian Swann graduated from the University of California, San Francisco School of Dentistry. After a 30-year career in public health and private practice, he shifted his focus to community dentistry and public health policy, leading him to Boston as the first Joseph L. Henry Fellow in Minority Health Policy. By 2008, he earned certificates in minority health policy from Harvard Medical School and oral health policy and epidemiology from Harvard School of Dental Medicine, along with a master's in public health from the Harvard School of Public Health. Dr. Swann is the immediate past chief of oral health for the Cambridge Health Alliance, where he integrated oral health with primary care, behavioral health, nursing, and pharmacy. He has implemented an innovative shared appointment model and helped secure $4.5 million for a multidisciplinary expansion. Now, as a consultant, he assists in developing integrated clinical models and serves as a regional oral health consultant to Job Corps of America. Additionally, he holds academic positions at Harvard, mentoring students, promoting diversity and inclusion, and has introduced oral health into the medical interview and curriculum. Dr. Swann co-chairs the National Dental Association's Global Oral Health Outreach Committee, working with vulnerable populations worldwide, including recent efforts with refugees in Lebanon and Greece. His contributions have earned him several awards, including the UCSF Dental Alumni Association Medal of Honor and the Albert Schweitzer Award and the Dean's Community Service Faculty Award. Please welcome Dr. Brian Swann. Thank you, Dr. Swann.
Thank you, Kid, for that introduction. I was wondering, who is this guy she's talking about? But, yeah, I've been around for a while, and so usually if you put your mind to it, you get a lot of things done, but you just don't always hear it in the way that you read it. So thank you.
Well, thank you. We are honored to have you here, and happy Oral Health Month.
Happy Oral Health Month, and I think that's an important topic, but I don't think that most people really know what it means. When we think about oral health, we normally think about dentistry, and dentistry normally helps us to think about teeth. But when we think about really what oral health is, you have to go deeper. And perhaps in the conversation today, we can sort of highlight on some of those aspects of oral health that make it a lot more important than just teeth. Yeah.
Yes. Absolutely. Well, we have several questions kind of prepared here, but we want to start off a little bit with just kind of talking about how everyday people can improve their oral health. So we all know that brushing your teeth twice a day is something we've probably heard a lot. But are there any misconceptions, or are there other habits that we need to do that maybe people forget that would improve our oral health?
Well, I think that brushing your teeth is fine, and we should do that a couple times a day. But why? Because we get plaque on our teeth. We have stale and dry mouth and breath issues when we get up in the morning. How do those things all work together? Well, you have a toothbrush, or you can chew tree branches, is what a lot of people still do in the world today. And a lot of those trees that are used for that are actually trees that have medicinal purposes to them. But brushing your teeth is not just as simple as that. You want to get the plaque off your teeth every day, because the plaque from the foods that we eat, most of the foods that we eat do contain sugar, whether it tastes sweet or not, they contain sugar. And sugar is acidic. And when it combines with the other film that gets on your teeth, it sticks to your teeth. And because sugar is acidic, and if you are sleeping at night, that's when your mouth is driest. So it means that the acid can do more damage, because this good stuff in our mouth that people lay terms call it spit or saliva neutralizes the acid that's in our mouths. So, meaning that the most important time to brush your teeth is before you go to sleep, because that's when your mouth is driest and that's when the acid does more damage. What about people who don't have the manual dexterity to brush their teeth?
Mm-hmm.
What about people who don't know that it's more important to brush your teeth at night than it is in the morning? We brush it in the morning because our breath smells stale and we want to have a fresh mouth. And that's fine. But in terms of the damage that's done, it's damage that's done when you are sleeping and your mouth is dry. The other thing that I'll kind of toss into that is we see a lot of advertisement on television about medications that people take. And they have to, by law now, tell you all the side effects
Right.
that go along with those medications. But one that they often leave out that applies to more than 600 medications that are sold across the counter, and not including the recreational things that people take to medicate, but they cause dry mouth. People who are stroke victims, people who are hypertensive, a lot of the medications cause dry mouth. And all you got to do is ask them, do you have dry mouth? Yeah. And it's because of the medications that they're taking. But we don't often coach them about the fact that this is something that you need to be aware of, because with dry mouth 24/7, you're going to get tooth decay.
Mm-hmm.
Well, because the acid is strong enough to eat through your enamel. And the enamel is the hardest substance in the body.
Mm.
So if it can eat through enamel, what can it do to your gut? What can it do to, your intestines? What can it do to the linings in your stomach? Yeah.
Well, let me ask you, Dr. Swann, are there things that you hear about on a day-to-day basis that are maybe some home remedies that people are trying to employ, thinking that they're actually helping their oral health when it's doing the opposite? Can you
Mhm.
share something like that with us?
Well, okay, so maybe a person that doesn't have toothpaste will put baking soda or salt on their toothbrush. Well, salt is too abrasive. Baking soda is abrasive, but not as much. And so baking soda used periodically is actually okay.
Mm-hmm.
And we see now that toothpaste also contain baking soda and fluoride and other ingredients to whiten your teeth, to brighten your teeth. But you should make sure that you also use, if you have a toothbrush, use a soft toothbrush, because over the years you can be pretty heavy-handed, and toothpaste have abrasives in them. That's what cleans it. So you want to be able to use a soft toothbrush, especially if you're going to be using baking soda and things like that. With children, um, taking a cloth, when you don't have a toothbrush for your child, it's an infant, just using a clean cloth to wipe their teeth off before they go to sleep at night. Being aware that the pediatricians are saying not to give children anything but water and milk.
Mm-hmm.
We're against juice now because people don't dilute it enough. And it has so much sugar in it that it's causing a lot of tooth decay on infants. And the teeth can decay before they erupt. Before you see them,
Wow.
they can already have decay because the sugar can penetrate the gum tissue. The acid is strong enough to do that. Other things that people do, I mean, sometimes they make their own concoctions for as rinses,
Mm-hmm.
so they'll take a rinse and maybe use something that you want to guard against rinses that have alcohol in them. And a lot of medications and things have alcohol in them. So we're advising people not to use rinses that contain alcohol. Listerine is a very powerful rinse. If you take Listerine and dilute it with peroxide, it's probably one of the most effective ways of using a rinse. But Listerine has finally gotten wiser, and now they make a Listerine mouthwash that does not contain alcohol.
Mm.
We look at the addictions that people have. So you don't want to take alcohol if you have an alcohol addiction. Um, Here in Appalachia, we see a lot of meth mouth.
Mm-hmm.
People who make recreational drugs and use them, which does two major things. Well, you crave sugar, you don't eat, and your mouth is dry.
Mm.
The perfect storm for the patients that we see, especially through RAM, we see a lot of them, and where every single tooth in the mouth is decayed, and most of the time beyond repair. So it's kind of going back to this thing about, the acid that's in sugar. That's the real culprit that causes tooth decay. Now we also look at gum disease. And gum disease, people lose more teeth from gum disease than tooth decay on average across the world. And dental disease is the most prevalent disease in the world for both adults and children. But what the problem is that when people have tooth decay and gum disease, they don't think about it being a disease because it doesn't always have to hurt. When you do get a toothache, it's in the head next to the brain. So it drives you crazy. You will do anything. I've heard people say that they wanted to kill themselves because of tooth pain, because it's in the cranium, right?
Yeah.
But it is important to understand that gum disease, relative to the other things that we talk about, systemic diseases, gum disease is even more of a culprit. And one of the things that I've seen here in Appalachia is I've seen people who have died from infections in the mouth. Now that gum disease, but primarily tooth disease, tooth decay, that gets into the spaces in the neck and not treated with antibiotics. People want to relieve pain, that's good. But if you don't have antibiotics to control the infection, then you can actually die from disease in the oral cavity. So we want to bump this up a little bit and really get serious about oral disease. It's more than just, teeth that look like chiclets because you had them bleached. That's not the bottom line. But go ahead.
Well, I was going to ask you, you had mentioned gum disease. I know there have been studies that have talked about the connection perhaps between diabetes and gum disease. Can you talk a little bit about that relationship and what are some of the signs of gum disease that we should watch out for?
Well, first of all, the signs of gum disease can be bleeding, can be swelling, can be painful. If gum disease, which we call gingivitis, is untreated, your mouth is dry, you're taking medications, you're an elderly person, you don't have manual dexterity, so you can't brush your teeth very thoroughly. You don't know that cleaning your teeth is not enough, but using a toothpick or dental floss or something that gets between, even I was baling hay today, using a piece of hay, anything that goes between your teeth to clean the plaque and the tartar that gets stuck in between your teeth is significantly important. And people who only had a piece of straw to go between their teeth still have their teeth. But people who lose their teeth into gum disease, meaning that the plaque gets hard, it turns into something called calculus or tartar. And that eats away the bone that supports your teeth. Now, the problem with diabetes is the inflammation. All of this creates inflammation stemming from the oral cavity or the mouth that gets into the bloodstream and goes the rest of the body. So these issues with inflammation and combined with diabetes, which reduces your ability to heal, they feed on each other. So the gum disease exacerbates the diabetes, and the diabetes exacerbates the gum disease. They work bidirectionally, so you don't heal.
So kind of a vicious circle.
It's a vicious circle. Yeah.
So what should somebody do if they do have a dental emergency? Let's say I get part of my tooth knocked out. What is the first thing I need to be considering?
Well, if your tooth is knocked out and it's still intact, put it in some milk or some fluid and get to a dentist right away and see if that dentist can re-implant that tooth back in your mouth. And most of the time it works. Now the tooth may die, but a root canal will get you back in business. So you want to implant that tooth either that same day or at least by the next morning. The problem is how many people have a dentist to go to?
Right. Exactly. You had
Well,
mentioned earlier, talking about the possibility of having dental and tooth problems even before the teeth erupt. Can you talk about the connection between oral health and pregnancy and not only the impact on the child, but also on the mother?
yeah. Well, it's interesting, but this thing that we were talking about earlier, gum disease, that inflammation on a pregnant person, woman, um, can have an impact to the point that it increases the possibility of low birth weight or pre, I think the word is preterm delivery. In other words,
Mm-hmm.
you can have your baby earlier, or your baby will come in at a less weight. And this is a 25% increase of that happening. That
Wow.
stems from gum disease. So many medical schools don't teach their medical doctors anything about oral health,
Yeah.
which is an interesting problem
Mm-hmm.
because we are living at a time where all over the world, including the United States, where like you have food deserts, you also have medical deserts. And even more profound, you have dental deserts.
Mm-hmm.
And so you have places where there's no access to care. And if there's no access to care, who are the people who you would go to? Well, you'd go to the ED, the emergency department at a hospital. You go to urgent care, where you're going to find nurses.
Mm-hmm.
But generally speaking, in the United States of America, medical doctors don't get a chance to learn anything about oral health. And nurses, the largest healthcare workforce in the world, most of the nursing schools do not have oral health in their curriculum.
Yeah.
So then let's go back to why you have a mouth in the first place. What's the value of a mouth?
Right.
And
To
if you
help
can,
nourish your body. Yeah.
right. So, yeah, I mean, you can think of all kinds of things that the mouth is used for. Why would it be left out of the curriculum of nursing, medical, and pharmacy schools?
Yeah.
So I get to Harvard and I'm just a guy, who's decided to go back to school to understand the language of public health. And I go into this class where medical students and dental students were in class together for 2 years before they separated.
Mm.
The dental students learned all the medicine that medical students were learning. The medical students did not learn not one thing about oral health and dentistry.
Mm.
So I'm talking to third year medical students and I'm saying, well, children's teeth are lettered, A, B, C, D. So, and adult teeth are numbered 1 to 32. And they say, oh, we didn't know that. Okay. Children get 20 teeth by the age of 2, starting around 6 months. Adults, those adult teeth start coming in on an average of 6 years old up until 17 or 18 if you have room for your wisdom teeth. And you get 32 if you're lucky.
Mm-hmm.
And the medical students would say, didn't know that either. And I say, well, what the hell?
Yeah.
You tell me at one of the top universities in the world, where you are sitting next to a dental student for 2 years, you don't know anything about
Mm-hmm.
oral health or dentistry?
Dr.
When,
Swann, do you
yeah,
feel like you're seeing a shift now to a more integrated, holistic approach to this, or is there still that level of separation of the disciplines?
the level of separation is still there. There are universities, Harvard being one of them, University of Connecticut and others, who are starting to make that happen. But it's like pulling teeth.
No pun intended.
No pun intended, but it is a policy issue.
Yeah.
And changing policy takes too much time often.
Yeah.
And for nursing, I've worked in countries in other parts of the world where a country of 10 million people had 25 dentists.
Wow.
All 25 dentists were in the capital city. We see that same scenario in America.
Mm-hmm.
The dentists are in the major metropolis. It's understandable. You're running a business, you're trying to be where most of the people are, and people have benefits and insurances. But the rural areas are lacking.
Mm-hmm.
And therefore, one of these countries were poisoning children that were born with cleft lips and cleft palate. If they had 25 dentists, 600 medical doctors, but 3,000 nurses. So if you're going to create an intervention, where would you go?
You start with the nurses.
You start with the nurses.
Yeah.
But because it's not traditionally done, you have to go through a lot of hoops before it gets accepted as a part of the curriculum, which gives it a certain amount of sustainability.
Yeah. Well, you having been a part of RAM for years and being at clinics, can you share any personal stories of patients at RAM clinics that sort of illustrate these challenges that we're talking about with communities that do have limited access to oral care? Are there anything that jumps out you remember specifically?
Well, I mean, there's a lot of stories that go with RAM. Every time we volunteer for RAM, there is a story. And the most common story is that people come in who are marginalized because of income, because of education. And most of them do not have a medical or dental home. They get a voucher for vision, for medicine, or dentistry. And what RAM didn't know, what they eventually found out, the greatest demand was for dentistry and oral health. Because you can't find it, or it's too expensive, or it's not in your community. And so therefore, you still have people who are getting all their teeth taken out because they think that they inherit soft teeth in their families. And they want them taken out at an early age, 20s, 30s, and 40s. We still see that. We see people who are not treated with dignity. The big blessings in working with RAM, the RAM volunteers are people who want to pay it forward. They desire to make a difference. And the first thing that you see, which is a mental health issue, is that people are smiling and coaching you and treating you like a human being. To me, that speaks volumes. It speaks volumes because here you are trying to help another human being. There's an African term called Ubuntu, and it says, I am because you are. You are what? You are human. And so this is the first thing that I saw and noticed about RAM. And then the next thing about RAM is the fact that they follow all of the CDC guidelines about infection control. When you come to a clinic and everything is being sterilized, people are wearing the PPE, and sterilization and disinfection with the number of minutes that you can't go into an operatory for a chair, it's 20 minutes. They follow all of those guidelines. So people watch that. We have negative air pressure sucking out the aerosols. And we should have been doing that before COVID. Every dentist knows that. All right. So RAM was following all of that. And then when people come in, you have students working with faculty, you have doctors who have retired, you have doctors who are still in practice, you have dental hygienists, you have nurses and assistants, all working together collaboratively to create a good experience for the patient, but a great learning experience for the young people who are volunteering, to let them see that this is also America, that there are people who are not served. And the stories come after that, where people find someone who is teaching them as they're treating them and explaining what they're going to do and making every effort, and people realize this, to not hurt them, to try to make the experience as comfortable as possible. So I have grown men 6 feet tall want to hug me and pray with me and tell me how much they appreciate me for the work that we shared together, because I can't do it by myself. To have students there, to watch patient rapport and how you talk to them, to work in places like Jellicoe for prisoners and have these guys give you the high five or thumbs up, after you have removed 7, 8 of their teeth, and explain to them that you're going to have to follow the guidelines that I give you, because if you have a dry socket, you're going to be in pain, and maybe there's not going to be anybody around to get you out of that pain. So please pay attention. And to admonish them when they start spitting, when you told them not to do that, and then have them not curse you out, but to actually give you a hug and have that thumbs up and say, I got it, doc. And this goes beyond these so-called barriers that we deal with every day. It goes beyond, the fact that I'm 5'6" and somebody else might be 6'3". It goes beyond that I don't have much hair and you got a head full of hair, right? It goes beyond my eyes being brown and yours being green, or the color of my skin, or this gray beard and me being an older guy. It goes by all that crap is put to the wayside. You almost made me cuss. It almost is put to the wayside, and people are appreciative of the fact that you treated them like a human being.
Absolutely.
It's the human touch, and that generates a story every mission.
That's wonderful. We have a great question that was in the Q&A box. If medical professionals could ask one question consistently when they are meeting with their patients to help improve their oral health, what would you recommend that one consistent question be?
Wow, that's a dynamic question. I have to think about it. I mean, there's a lot of questions that I would ask. One being, are you in pain?
Yeah.
But maybe a significant question is, do you know how to take care of your mouth? Do you know the value of having a healthy mouth?
Yeah.
And from that, we can generate a whole conversation. And that's important. I ask students who are applying to dental school, what's the mouth used for? And they'll say, well, it helps you to chew your food. It helps you to talk, to swallow and that kind of thing. The first stage of digestion. I said, well, how significant do you think that is?
Yeah.
We could spend a whole year just on the fact that you're using it to communicate, not only by talking, but by expression, smiling, frowning, all that, right? With or without teeth. And then I ask the question, what else is the mouth used for? And they usually he and haw about it because people are embarrassed to talk about it, but it's also used for intimacy.
Exactly.
There was a song that was out back in my day, and it's in his kiss.
Yeah.
And what the song was talking about is that, we can hold hands, we can touch each other, we can do all kinds of stuff, but it is the kiss that signifies something more.
Yeah.
It's the intimacy. It's saying that I really care for you. But we also have to be able to talk about what's in the kiss.
Yeah.
Bacteria that creates tooth decay is transferable.
Yeah.
The bacteria that creates gum disease is transferable.
Yeah.
Also live in an age of HPV. It's transferable.
Yeah.
So we have to pay attention that, yes, this very intimate, private part of the body that no one goes into except probably your doctor.
Yeah.
And if I show a slide of the oral cavity and to 6th graders, and I tell them this is just a normal mouth, but they all are going to moan and groan and say the word because it looks like an alien in there.
Yeah.
It's a window to your body.
Yeah.
It's one of the orifices that's used to pick up on whether or not you're a healthy person or not. And when farmers, I live on a farm, when farmers look at an animal, they're looking at two things. They're looking at their dentition and their gums, and they're also looking at their toenails or their hooves. We do the same thing with humans.
Yeah. Such an indicator of our health. Yeah.
It's an indicator of our health.
Yeah.
Right. You can
the mouth being used to nourish the body, but also when you're talking about the intimacy and just the connections you make smiling with someone and giving those kisses and things like that. It's nourishing, your heart and your soul as well. So
Right.
yeah, absolutely the importance of all of that. Um, how can everybody, individuals, be advocates for oral health change beyond just, let's say, volunteering at a RAM clinic?
Well, I think that, because policy moves mountains, it's important. And I was in a Senate hearing 3 weeks ago at Congress. And what I realized is that there are just a few people who really understand the real value. And what I wanted to tell them, I didn't get a chance to do it. If I were running for office, I would just bring dentistry into my community.
Yeah,
I don't think I would have to advertise any more than that. If I brought oral health programs that were really doing quality work and cared about people into my community, my constituency would all vote for me.
absolutely. Dr. Swann for president.
Yeah, there you go, right? So it's important for people to understand policy. And,
Mhm.
and, and dentistry would be further along, and we'd be doing a much more, we would be much more comprehensive. And when I say comprehensive, I mean that we would insist that oral health be trained in all the medical, nursing, and pharmacy schools. We would insist that the commercials on TV that talked about the risk factors of medications included dry mouth syndrome and the
Mhm.
impact on the mouth. We would insist on making it and bumping it up so that dentists were not just running small businesses and trying to support those businesses, but the government would support them to make sure that when
Mhm.
they saw Medicaid patients or when they saw patients that didn't have benefits, that they would have rates that would be affordable,
Mhm.
that we would
Well,
train people in a way that there would be externships and also internships that would put them in clinics in rural areas. We would use teledentistry and telemedicine more wisely.
mhm.
There's too many people in middle America. There's too many people in rural America. There's too many people in urban deserts that are not getting health care. And one of the things that COVID tried to teach us is that we can't afford to have unhealthy people in our communities. We need to make sure that our communities are healthy because disease is transferable.
Mhm.
Habits are transferable. What we are eating, is we need to look at that even more closely. Why is
Mhm.
it that the wealthiest country in the world does not have restrictions on the ingredients in our food, whereas you go to Japan and other countries and you can't advertise that junk to children, nor can you have more than a percentage
Mhm.
not having meat in a McDonald's. Even McDonald's changes their criteria outside of America, so the
Wow.
food is healthier. Why are we not doing a better job of getting our people to lobby by educating them about what we should demand for better health? And the mouth is just one of those areas that we have often disregarded. And politics are involved in making those changes.
Mhm. As you prepare students to come to a RAM clinic, maybe somebody has never come to one, doesn't know what to expect. What sort of advice would you give them in terms of preparing for what they're going to see and what they're going to experience?
Well, I would tell them that, um, there's probably 75 million Americans who could come to RAM clinics because they don't have what it takes to get to a dental office. And, when I'm talking about dentistry, I would tell them that you want to look at every one of these particular cases and understand that most dental disease is preventable. Why isn't that being broadcast and advertised?
Yeah.
So in a language that people can understand in their culture, their subculture, whatever it might be. That
Well,
you, as a student, need to look at these volunteers who are taking time out of whatever they would normally be doing to pay it forward, not just to give back, but to help people to do better for themselves. I would also tell the students that RAM, just we're advocating that now, we need to have a stronger preventive program. That's why we're doing
absolutely.
these podcasts and things like that, to teach people about what they can do to prevent disease and to understand that when you are a student who's training to be a doctor, nurse, or hygienist or an assistant, that you want to carve out a particular part of your day or your week or your month or your year to pay it forward in your community.
Mhm.
Going out to schools and teaching children how to take care of their health, overall health, not just oral health. going to convalescent hospitals and teaching nurse assistants how to put on gloves, put on a mask, take those dentures out of the patient's mouth, make sure the lab puts their name in the dentures so that if they get lost, they can get back to that patient and clean that person's mouth. Because if their mouth is sore with lesions and ulcers, they can't eat. And if they can't eat, they're going to die.
Exactly.
This is what the children and the young people that are coming to RAM clinics need to see.
Yeah.
Not just what kind of car you're driving, but also that you are working to make for a better community, a better state, better nation.
Absolutely. Well, so as you know, and as many people know, RAM recently launched our digital denture program that we're very excited about. Can you speak to the importance of dentures for folks who need them, and how important that is for people to have access to dentures as well?
Well, I think that dentures gives people a new lease on life. For people who have, for whatever reasons, lost their teeth, to have a set of dentures that it fits, it's comfortable, that they can adjust to, learn how to eat with, that gives them a nicer smile, boosts their confidence. At least 50% of dentistry and oral health is the behavior sciences, mental health. And your self-esteem plays a major role in how you relate to yourself and how you relate to other people. So having dentures allows you to have maybe more self-esteem if you wear them. It's not the perfect solution by any means, but it does give people an opportunity to go to that wedding or whatever the occasion might be and be able to take those wedding pictures with a nice smile. For a lot of people who have difficulty chewing certain kinds of food that keeps them healthy, having dentures that you become accustomed to through practice, you can masticate and chew food and improve your digestive system. And as we age, being able to digest is extremely important. And you have to make sure that when you have dentures, that you get them adjusted. As you wear them and practice wearing them, there will be some areas that will be uncomfortable. Rather than throwing them in the drawer rather, maybe the jar too, you want to come back and have them adjusted at a RAM clinic. It usually takes 5 minutes to get you a more comfortable fit. But this is new technology. What it means is that RAM and the dentists that are working with RAM can basically make you a set of dentures in a day, whereas we would take, weeks to make one normally, but in a day. And so we're perfecting this. These clinics are going to be set up in different places, coming to the RAM clinics. They also have a contract with Walmart and others to be able to bring these to where people are. And that's the other beauty of RAM. RAM goes to communities in which they have been invited to.
Absolutely.
It means that we're not stuck in an office all the time and expecting people to understand why it's important to come to the dentist. And I don't call myself a dentist anymore. I call myself an oral physician. And the reason is because I'm concerned about whole body health with a particular interest in the oral cavity. And so it elicits a different conversation. But to be able to get out of the office and to go where the people are is extremely important. It's just another one of those valuable assets for an organization like RAM, who sees the value in understanding and meeting people where they are. This is extremely, it's an invaluable asset.
So I have another question here that was asked. Has there been something in your career that has changed your outlook on dentistry? And I know you mentioned earlier, being around those students and seeing the separation at some point between, medicine and dentistry, but has there been something in your career that has really changed your outlook?
Well, my career started out with wanting to find ways to give back to the community. I was told by one of my professors, he says, if you're going to be doing outreach work and working with low income communities and so forth, you should wait until you retire. And maybe when you're about 65, you can start giving back. And I says, well, there's no guarantee that I'm going to live to be 65. And furthermore, with people dying and unhappy and uncomfortable and uneducated about how to fix these problems, the urgency is right now, not when I'm 65. The urgency is now. So I try to encourage students who think that because they're going to go into the business of dentistry, to be careful and understand that the business of dentistry is fine, but it should not overrun the healthcare part of dentistry. And I think that one of the issues that I wrestle with now is that the business of dentistry, it begins to outweigh the healthcare issue. You have to make them coexist, and there are ways in which to do that. I was in private practice for 25 years, but I did things in my private practice that kept me involved with the community. 25% of my patients were Medicaid. I would go to every school, elementary and junior high school and high school in the area of my practice every year for 20 years, and do assemblies every Friday morning. And not just talking about dentistry, but talking about overall health, talking about students staying and not dropping out of school, getting an education, listening to your parents and your teachers, taking the initiative to take care of your body, keep it clean and healthy, try not to get pregnant before it's time. We talk about all those kinds of things. And so, and then tell the students, the reason that I'm here is not because someone's paying me. The reason I'm here is not because I'm trying to market my practice. The reason I am here is because I love you. Well, 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 well.
What was your original, or what was your initial inspiration in going into dentistry? Did you always want to be a dentist?
No, I wanted to be an engineer or a farmer. And
well, it sounds like you're a farmer now, right?
I am now, you see. And so you just keep living, and you sometimes get a chance to go full circle. But not only that, but doing dentistry, I always worked, I worked a lot in different parts of the world, but a lot of it involved farming communities. And the nice thing about that, and what we also find out about just working with any group of people, is that they teach you as much as you're teaching them. It's a reciprocation. And that's really the beauty of being able to be a dentist or be an oral physician or a doctor or anybody in the healthcare profession. You have the opportunity to work on your own biases with each and every patient that you see. So to become a really good healthcare person, you have to be able to absorb that and learn and understand that this is a reciprocation. But what got me into dentistry was my mother. My mother and I mean, we, the family, my two brothers and my dad, we left Tennessee and moved to Northern California. And she did what her mama did for 35 years. And that was to clean houses and to be a maid. So when we moved to California, she went to work for a wealthy family. And she learned after a couple of years that, they had problems just like everybody else. They weren't any smarter than she was. And she saw an ad for a dental assistant. And she decided she was going to go to college. And so she went to dental assisting school, and I was about 12. And I drew her sketches, her diagrams of teeth. She didn't have, she couldn't draw very well. And so that got me involved in dentistry. And then when she took me to the dentist, because in my community in Tennessee, you got to the dentist to pull a tooth out. It wasn't about prevention. It wasn't about fillings. So we went to the dentist at her place where she worked, and I had 13 cavities. Therefore, besides her working there, I, as a patient, spent a lot of time in the dental office. And what I noticed about the dentist is that he was well respected in the community. He was his own boss. He could work anywhere in the world, and he could retire whenever he wanted to. And then he had this cool dental chair with all these gadgets, and he was working not just with machinery, but he was working with people. That combination is what attracted me to the field of dentistry.
Well, that's wonderful. We do have a question that was submitted. It says, how do you increase the good bacteria in your mouth with probiotics?
Well, that's a good question, and probably out of my pay grade to really answer that question. I just know that, if we're going to have a healthy dentition, it does have to do with what we put in our mouths. I don't know a lot about what the probiotics does for a person's dentition. I do know that, the structure of teeth and I'm trying to think of what the name is. It'll come to me probably after this podcast is over. But it is a mineral content, and we argue about fluoride. Is it going to poison people? No, there's fluoride in a lot of things naturally.
Mm-hmm.
It's about how much of a good thing are you going to use? And we know that, I don't want to get biblical here, but the Bible teaches us not to do things wastefully, or you do things in moderation.
Mm-hmm.
And so I just think that healthy diets, healthy foods, probiotics included, within moderation, is good for the whole body. And the mineral contents of all of that is certainly going to be healthy for teeth. We do think that most people don't get a lot of new decay on teeth after around age 25, but that changes when we start looking at things that we're putting in our body, like some of the recreational drugs or even medicinal medications that cause dry mouth. We also know that radiation, for people who have to have radiation therapy in the head and neck region, will also cause dry mouth. And without saliva, you're going to get decay. And that decay usually is cervical decay in the most sensitive part of the tooth, around the gum line. That's when the enamel stops. That's when access to this nerve tissue is greater. And we see people in extreme pain. And if you're still doing whatever it takes that's causing your mouth to stay dry, fillings will pop out. No filling, no crown is made to last forever. Nothing that we do can be guaranteed. You're a human being. Your habits are going to affect whatever is going on in your mouth, including the rest of your body. So I don't think I answered that question specifically, but if you like, I can research it for you and get back to you with a clearer answer.
Oh, I think that's great. It looks like I have another question coming in here. Oh, someone said that the word you're looking for was hydroxapatite. Does that sound right?
Yeah, appetite. Mm-hmm.
Okay.
Yeah.
All right. Well,
thanks for that.
I probably butchered that pronunciation. So one last question.
Hydroxyapatite.
Hydroxyapatite. There we go. Last question here. If you could describe the RAM experience in one word, what would it be and why?
Well, it would be servant. RAM is being a servant. And the founder of RAM was a guy who, Stan Brock, who had a life of service. He was a humble person. He lived with indigenous people most of his life. He did exceptional things that were quite natural, being a rancher, dealing with wild animals, dealing with indigenous people and their customs. And he learned, the basics, I think, of what life is really all about. And remote area medicine was derived from the fact that he had a back injury that meant that these indigenous cowboys had to carry him in a stretcher for 29 days with a broken back on a river pathway to get to the nearest healthcare facility. And he made a pact with himself that if he ever lived through that, and if he ever made any money, he would donate all of it and dedicate it towards remote area medical teams, supplies, clinics. And so he lived his life, a life of service.
Well, thank you so much. It has been an absolute honor to be able to talk to you this evening on behalf of Remote Area Medical and all the folks that are out there listening and all the patients that you have served. Thank you so much. We are honored to have had you here and to be able to talk to you during Oral Health Month. Thank you so much. And we are absolutely grateful for the volunteer work you have done and the advocacy you are doing and in changing the way people are thinking about oral health and looking at it in a more holistic way. We are so grateful. Thank you very much. And folks, be on the lookout for information about our next webinar next month. Topic TBD. Thank you so much for joining us this evening.
Bye-bye.
Take care.